I'm Dr. David Mickle, founder of Mickle Therapy, and I'd like to speak you through what I believe is the underlying cause of chronic fatigue syndrome, ME, and fibromyalgia, and that is namely something that I've dubbed hypothalamitis. The hypothalamus gland is the most important gland in our body. It's very small, it's central in our brain, and its job basically is to keep the whole body in balance. So there is nothing that happens in any part of our body without the hypothalamus hearing about it and then taking action to try and correct any imbalance. When the hypothalamus goes into overdrive, and in your first session of your treatment with a Mickle therapist, they will be starting to explain to you why this happens. So rather than look at the why, I would like to just explain to you in easily understood language, physiologically, how your symptoms are created. In order to do so, you may find the diagram that is available on the website useful to refer to. The principal nature of hypothalamus, being to keep everything in balance, means that it has to have an inbuilt thermostatic control, if you like, not for temperature, but just for keeping everything running smoothly. Now, the way I like to think about that is I imagine that the hypothalamus is keeping everything balanced by sending out signals at a rate of 3. So all the neural and hormonal chemical signals to the body continue at a rate of 3. What happens in conditions of chronic fatigue syndrome, ME, fibromyalgia, is that the hypothalamus gland shoots into an overdrive state. So let's say at the worst spectrum of the illness, the gland is going at 30. Now, in summary, before we look at some individual symptoms, what happens there is it effectively is starting to overwork the body. It's putting unnecessary demand on the body and making it work very hard. Now, in a normal situation, this would feed back to the hypothalamus and it would slow down in order to let the body recuperate. However, in hypothalamitis or chronic fatigue syndrome, ME, and fibromyalgia, this mechanism no longer works. It's almost like it's stuck at a higher rate. And if we look at some of the classical symptoms, if we start with a lot of people experience bowel upset. It's almost like they become intolerant of certain foods. This presents with bloating, cramps, diarrhea, constipation in some cases. What's happening there is the hypothalamus, through part of our nervous system called the autonomic nervous system, is it's effectively triggering the gut and telling it to respond to anything that comes into it as a potential poison, if you like. Now, the way it deals with this is initially it creates a lot more acid in the upper parts of the stomach, so it produces a lot of acid, and that can lead to burning and indigestion and heartburn. Now, when the acid contents with the food pass into the lower part of the bowel tries to counteract that by making it more alkali, to dilute the acid. Now, part of this creates more flood of fluid into it, so people can get diarrhea, and it's almost as if the bowel is trying to get things out of it quicker than it should. At the far extreme of this imbalance in the acid-alkali balance of our gut can lead to the overgrowth of thrush or candida. Now, I would point out to you that any of you that have tried candida-type diets will see the restriction in that in the treatment of chronic fatigue syndrome, ME, and fibromyalgia. This is principally because that is an effect, not a cause. And when we correct the underlying hypothalamus overdrive, if you like, everything goes back to normal and the candida will recede. Moving further on to some of the more common symptoms of this condition is the effect on your muscles. Now, they are weak, they are occasionally very painful, especially in fibromyalgia, and they don't function like they used to. Your exercise limits are much, much reduced. Now, what's happening there, if we imagine the hypothalamus sending out signals through the pituitary to the adrenal glands, is it effectively floods the whole body with chemicals of exertion. Now, imagine these chemicals of exertion entering into the muscles, and although you're lying doing nothing, it makes them work as if you're carrying about several heavy tables and running. This explains why people go to their bed, when they wake up in the morning, they don't feel any better. They feel equally exhausted. And that is effectively because their body is chemically running a marathon as they sleep. This also has the effect of producing a lot of lactic acid. Muscles that chemically exert themselves use up stores of the fuel and produce a byproduct, lactic acid. Lactic acid's that painful feeling that when we're healthy we have when we've exercised when we're not used to it. However, in chronic fatigue syndrome, ME, and fibromyalgia, it's chronic and it's consistent, and it's overproduction of lactic acid. The only way to remove that effect is to put the hypothalamus back to normal. These muscles are also using up a lot of fuel, as I say, and this is effectively sugar. So many of you suffering from this will recognise times where you feel like your blood sugars drop and you feel a bit sicky and dizzy. Adding on to this dizzy effect of low blood sugar is the effect of the blood that is required to take fuel to the muscles is being diverted away from what we call your core. This effectively means that you develop hypotension or low blood pressure. And this is noticeable when you get up a little quickly, you get very dizzy or you see dots in front of your eyes. And again, this is an effect of hypothalamitis in overdrive and will go away when we treat the underlying condition of hypothalamus. Secondary to that, and another common symptom, is the headache that people get. And this is quite often described as a vice-like, just like the brain's too big for the head and it's extremely uncomfortable. Again, if we remember that the scalp is just a large muscle that covers the skull from the back, round the sides and at the front, is that effectively through chemical exertion it is just tightening and increasing its tone slightly, and it really just presses down the skull, stimulates all the nerve endings there, and it makes it feel like the brain's too big for the head. And again, when we apply mycotherapy to this, correct the hypothalamus, that will go back to normal. One of the things that quite often happens at the start of ME, chronic fatigue syndrome or fibromyalgia, is people appear to have it started by a viral infection. But let me show you, using this model of hypothalamitis, why that is not in fact the case. It's an effect and not a cause. If you imagine that just prior to developing the severe part of the conditions, the hypothalamus is starting to go into overdrive, it stimulates the immune system to reach a peak. Now, that's a good response. However, our cells can't multiply at that rate, and effectively they run out of cells, and so the immune system crashes. Now, at that time, we're surrounded all the time by opportunistic infections such as glandular fever or influenza or Coxsackie B virus or common cold. At that time, the infection gets in, and because the hypothalamus was already going into overdrive, it appears that that's the trigger to it. But I would point out that I strongly believe that that is an effect, not a cause. So, following on from that, so after the initial virus, there's one of two things happen. People with chronic fatigue syndrome, ME or fibromyalgia, will describe one of two things. They will say, it's really interesting, I never get a cold. Now, previously this has been inexplicable by medicine. Certainly when I was a general practitioner, it didn't make any sense to me whatsoever. But I think what's happening there is, after the initial fall, if this is the normal level of immune system, when the hypothalamus is still triggering it to get stronger, get work, it actually rises, and you've probably got about an extra 60% immune system, and that's why you never get any infections. The other group of people, which appears to be about 40%, after the initial collapse of the immune system, they never actually manage to get up to their optimum, and so they stay suboptimal, and infections continue to come in, and they have one infection after the other. There is another subset, and this is very important. When I was in general practice, people with the conditions of chronic fatigue syndrome, ME and fibromyalgia, often present and say, you know, they're getting another cold, and certainly you look at their throat, it's red, they've got glands up, their ears are red. But I took swabs in so many of these cases over the years, and they kept coming back negative, that I can only assume that this is the body defensively acting like there could be an infection in order to get ready to defend itself. So the way the body does this, under the guidance of the hypothalamus in overdrive, work, remember, is that it fills the glands with fluid, because that brings us antibodies and defense against infection, so the glands go up. The throat at the back fills with blood. Now, blood is warm, it's at the 37 degrees. Now, because it's near the surface on the back of the throat, it looks red and it dries out and it becomes that dry, tickly or painful, and that's what feels like infection. Similarly, people describe getting a lot of head catarrh and ear catarrh. This is again just the immune system acting as if it's got an infection, when indeed it does not. And when we correct the hypothalamus, that should return to normal. Now, when the people who've had the higher immune system never get anything, probably one of the first things they'll experience is a cold. And I don't often get a lot of thanks for that, but in the long run it's a very good sign. So that's a general overview of some of the more dramatic symptoms associated with hypothalamitis and its overdrive. Any other ones that you have to get explained to you, if they're not explained by reading the book prior to your first appointment, which is recommended, then your mycotherapist is trained to go over them with you if you have any questions regarding that. I would strongly advise that you're able to move quickly on for that, so prepare yourself for your first session, because the crux of the work comes from explaining why it happens, not what is happening. We know from medical research that many millions are spent in looking at the fine detail of what happens in muscles in hypothalamitis, but it gets us nowhere nearer to knowing what to do about it. All your therapists that you can go and see, mycotherapists, have the tools to be able to move into that phase, which is really what's going to get you well. Thank you, and I wish you all the best with your treatment, and you can trust that it will be good.